Hey, I'm Dr. Matt with Kinetic Health Sport. Today I wanted to cover some lower extremity nerve gliding or nerve flossing, okay? Now we have two major nerves in the lower extremity, our femoral nerve, which is in the front, and then our sciatic nerve, which is mostly in the back, okay? And a lot of people are familiar with that one because that's the most common one to have low back pain and nerve irritation, okay? It's a big one, so it is pretty common to feel. So when those nerves are irritated, we can mobilize them in a very particular movement pattern that helps them get good circulation and help decrease any adhesions and hopefully decrease inflammation. Okay, so we're going to start with the sciatic nerve since it's the most common. So sitting with your knees all the way back against the edge of a chair, we're going to begin by kind of rounding our spine or slouching as much as possible, okay? From here, with our chin tucked, we're going to slowly lift our toes and start to straighten our leg. Now, if you have nerve pain, you're going to hit a stopping point pretty early where that nerve really starts to get pulled on and irritated, okay? From there, we're going to relieve the tension on the nerve by keeping our leg here and pointing the toe. Okay, that should take some of it away. And from here, we're going to move our head and our foot together. So I like to say nose up, toes up. Nose down, toes down. And we go nice and slow. And what this should do is allow us to glide that nerve by tensioning it and slacking it, and then tensioning down low and slacking up high, and we're just moving that nerve up and down along the tissues it runs between. And we do that about 5 to 10 reps, nice and slow. Okay, and then we should be able to go back to that motion, test, and get a little further, okay, than we did before. So that's the sciatic nerve. The femoral nerve is one where we actually lay face down, okay. And we want to go into some extension, okay? And what we're going to do here is we're going to start with our head down, okay? And we're going to be kind of challenging the front. So we're going to point our toe and bend our knee. And once we find some tension, okay, we're going to flex our foot so our toes the opposite, and then it's nose up, nose down, toes down. Go into that same pattern again, okay, where we slack and we tension at opposite ends. Going through that motion 5 to 10 reps, okay. Now if you don't have trouble with this one, that's fine, you don't have to do it, but just looking for irritation, get some motion. We say motion is lotion, movement is medicine. Okay, give that a try if you've got nerve pain. Good luck.